10 signs and symptoms that may suggest you are suffering from an STI. Remember, an STI is a sexually transmitted infection. In our previous video, we tackled 19 STIs. The link is down below. Go and check them out. So, what are the signs and the symptoms that may suggest you have one of these? Remember, a sexually transmitted infection, you might acquire it through oral sex, vaginal sex, or anal sex. So, what are these signs and symptoms? Let's tackle them. There are about 10. Number one is pain or burning sensation during urination. As you urinate, you should have a very smooth, no iota of pain. But when you're starting to experience pain or a burning sensation, to an extent you want to scream and call your wife or your girlfriend for help, that may suggest that you may be having an STI and you should come to me for checkup. No medication without checkup first. Number two is unusual discharge from your genitals. Remember, your genitals could be your anal area or your vagina or your penis, okay? A discharge that is unusual, of unusual colors. Let's say it's yellow. That's unusual color. That's unusual. You should, as a man or as a woman, you should have sperm as the only discharge. That is not actually discharge, as the only thing coming out of you, and it is white and it doesn't have any pain. For women, when they are about to ovulate, they have a clear discharge that is mucoid in nature. So if it is yellow, green, or white, and you have a painful urination or a burning sensation, and the odor, the way it smells so bad you cannot withstand it. That is another sign or symptom that you may actually be having an STI. Number three is genital itchiness or irritation. So, you feel a very sweet itchiness. You want to put your finger inside your urethra of the penis as a man to scratch because the itchiness is usually very sweet. You just want to scratch, right? If you hear that sweet genital itching, now they start to register into your mind that you might actually be having an STI. Number four is painful intercourse. Remember, intercourse are supposed to be enjoyed. Why? Because after foreplay, the woman produces lubrication. Lubrication is a mucoid fluid that allows the intercourse to go smoothly without any tear. Okay? So, now, when you're having painful intercourse, it means you have an infection. You might be having an infection and you should come and get checkup, right? Painful intercourse might be brought by other things such as lack of foreplay. But if you have given enough foreplay and you still find out that this person is going dry and now you're having painful intercourse, that should tell you that you should come and get checked. Number five is itchiness around the genital or anal area. If you start feeling some itchiness around that area, also if you start to see rashes, a rash that was not there before, you should be cautioned. If you see a chancroid, a painful blister around the penis, that should register into your mind that you might actually be suffering. An STI has caught up with you because of your sexual behaviors without using condom. Now, if you see warts around your genital area, and remember, genital area, we are talking about your vagina, your penis, or your anal area, right? If you start to see warts, that should tell you that you might actually be suffering from HPV, human papillomavirus. And we said human papillomavirus can cause cervical cancer in women. So if you see that in the mouth, some warts in the mouth, yes, and others in your vagina, and others in your penis or in your anal area, that should tell you that you might actually be a candidate of an STI. Raw abdominal pain. You feel discomfort and pain a lot of pain, a lot of discomfort, and this low abdominal pain comes with frequent urination. Kazi yako ni kukojoa. You're urinating. That should tell you that you are actually a candidate of an STI. Abdominal pain, yes, abdominal pain, and regular urination. And it's not because it's cold or you have drunk a lot of water. You just pressed every time you're pressed. That should suggest to you that you might actually be a candidate of an STI. Number one is sores and blisters. If you start experiencing sores around here, that we say it is HSV1, right? But now, if you see sores and blisters in your genital area, that should start telling you that you might actually be a candidate of what? Things like herpes simplex virus 2, HSV2, okay? Swollen lymph nodes around the groin. Area. There is some swollen lymph nodes. That should start telling you that there is a problem somewhere. You didn't have them before, now they are there, and now you're experiencing all these other signs. That should register into your mind that there's a problem, right? So there are other STIs that will not give you any of these signs. There's no what? There's no painful urination. There's nothing, okay? But you just have fever, all flu-like symptoms. That's why you go to the hospital and you wonder, why did the doctor send me a urine sample, a high vaginal swab? Why did he send me that? Because fever and flu-like might be a suggestion that you might actually be suffering from an STI. You did not use condom. You did not test these people. Remember, we also said hepatitis B and C can be sexually transmitted. So how do you know that you have them? Number one is jaundice. You start seeing discoloration, yellowness in your sclera. You see some yellowness, okay? That is jaundice. That's bilirubin. Means that you have chronic liver failure, all right? Jaundice, yellowness of your hands. That is jaundice. Remember, hepatitis B is sexually transmitted. And we said, how do you avoid this sexual transmitted infection? Number one, get tested. If you know you have an infection, get treated. If you know that you do not have, test your partner. Okay? Number one is to know yourself. Get tested. Number two, if you have an infection, get treated. Get treated. That's how we can control the spread. Get treated. If you cannot if it is like HIV where it cannot be fully eradicated, take your ARVs, take your medication properly. Reduce the viral load. If you reduce the viral load, it cannot be transmitted, right? It is undetectable and transmissible in the case of HIV. What is other one? You should condomize the use of condom. There is a female condom, there's a male condom. Always use condom. Use protection, right? If you use protection, you cannot transmit some of these infections. And those are some of the signs and symptoms of sexually transmitted infection. Remember, we said there are 19 sexually transmitted infections. Go watch that video. The link is up here or down below here. Just click it and watch. I know you just know about 5, but they are 19 sexually transmitted infection. Get treated, get to know yourself. Don't forget to like this video, subscribe, and share with your friends so that we can reduce the cases of STIs and we can put awareness out there. Right? Thank you very much. My name is Dr. Gomba, certified medical laboratory technologist in Kenya.